All right, I think we're live. I'm going to try and screen share again. All right, thank you everyone for bearing with us while we begin our live stream. Our webinar on why the CDC's new COVID-19 community levels matter, and we're going to explain all about them and what they do and don't mean. Thank you all so much for coming. How we're going to do this webinar is we'll talk about each slide, and then after each slide, we'll pause for questions. So you'll have time to ask any questions you have after each slide. We're going to go through some things that are a little confusing and complicated about community transmission versus community levels and what the different things mean. So you want to make sure everyone has time to ask any questions, so we're all on the same page throughout the webinar. After we go through all our slides, we're going to watch a short video about masks that ASAN put together based on our masks fact sheet. Finally, we'll talk about what to do to stay safe, and we'll have time to ask questions again.
So the big question around all of this is why this change matters. Big thing is we need clear information so we can stay safe. This new system makes it seem like COVID got better suddenly. That's not what happened. COVID-19 community levels are different from your risk of getting COVID. So a low community level doesn't necessarily mean a low risk of getting COVID. The risk and the number of people with COVID-19 didn't change. The CDC just changed how they talk about COVID. And we know that changing how we talk about it doesn't necessarily make things safer. COVID-19 is still spreading. People are still getting sick with COVID-19. People are still going to the hospital with it, and people are still dying from COVID-19. Next slide.
So why do hospitals fill up during COVID-19? People are really sick with COVID-19, what they should do is go to the hospital. And if there are many people who are really sick with COVID-19 and they need to go to the hospital can get full. When the hospital is full up, there's no space for more people with COVID-19, and there's no space for more people who are sick with something else. So for example, if you break your arm and you need to go to the emergency room, but the emergency room is full of people who are very sick with COVID-19 and you have to go to the hospital, there might not be room for you in the hospital. Sometimes people who are very sick with COVID-19 need a ventilator. A ventilator is a kind of machine that helps you breathe. Hospitals only have a certain amount of ventilators, so when people who are very sick with COVID-19, when there are a lot of them in the same hospital, the hospital can run out of ventilators. When hospitals fill up because of COVID-19, people don't get the help they need, whether they're coming to the hospital for COVID-19 or for something else. Oh, so before we move on, pardon me, does anyone have any questions about what we've covered so far? And I can see the chat if you want to read it out.
Zoe, your sound is fading in and out a little bit.
All right, I'll try and get closer to the mic. Thank you.
Yes, does anyone have any questions about the slides that we've covered so far?
So we're going to move on to the next slide.
So what is community transmission? Community transmission means how many cases of COVID-19 there are in a place. So for example, in Washington, D.C., community transmission is high right now. If community transmission is high in your area, that means you have a high risk of catching COVID-19. This is different from the community levels. The CDC says that community transmission is high when 1 or more out of every 1,000 people in a place get COVID-19. So 1 out of every 1,000 people might not sound like a lot, but because COVID spreads really, really fast, it's very dangerous. So if 1 out of every 1,000 people in a place has a disease as bad as COVID, that's bad news because it's going to spread very quickly and get a lot more people very, very sick.
Any questions before we go on?
Oh, nope, did not mean to skip. Lisa said, I've read that we should avoid ventilators in regards to COVID-19.
It's definitely, if you need a ventilator when you have COVID, that means you're very sick. But for people who are that sick, the ventilator can really help them get better. A ventilator is a machine that you connect the person to it and the machine breathes for them. So when someone is sick enough to be on a ventilator, it means that they're not breathing well on their own. So for those people, the ventilator can save their life.
And then what's the definition of community level? A very good question. And we're going to get that in the next slide. We're going to cover community transmission as it is different from community levels first. So community transmission means how many cases of COVID you get, or how many cases of COVID there are.
So besides community transmission, which is about how many cases of COVID there are in your area, the CDC has another measurement that's called COVID-19 community levels. They started using these in February 2022, and this is a new way to talk about risk from COVID. Basically, your communities, this is done by county. So your county's COVID-19 community level can be low, medium, or high. And the CDC decides what each county's COVID-19 community level is based on 2 things. The first thing is how many COVID-19 cases there are in the county. And the second thing is whether the hospitals in the county are crowded with sick people who have COVID-19. So the COVID-19 community levels, a county can get up to 2 COVID-19 cases out of every 1,000 people and still be considered low. And that's different than community transmission, where if you have 1 sick person out of every 1,000 people, that's considered high. So those sort of metrics are set differently. And that means that a place can have high community transmission, which means high risk of getting COVID-19 in that area, and still have a low community level. For example, like Dean said, in DC right now, community transmission is high, but our COVID-19 community level is low. The community levels are mostly about whether or not hospitals are crowded, because that's one of the things that they're based on. And the CDC uses COVID-19 community levels to tell people what they should do. For example, the CDC says to wear a mask inside if your county's COVID-19 community level is high. And here we have a chart that I'm just going to describe, which goes through what goes into calculating your county's COVID-19 community level. If you have less than 2 out of every 1,000 people in your county have COVID-19 and hospitals are not crowded, your county's COVID-19 community level is low. If less than 2 out of every 1,000 people in your county have COVID-19, but hospitals are crowded, your county's COVID-19 level is medium. If more than 2 out of every 1,000 people have COVID-19 in your county, but hospitals are not crowded, your county's COVID-19 community level is medium. And if more than 2 out of every 1,000 people in your county have COVID-19 and hospitals are crowded, your county's COVID-19 community level is high. Do we have any questions about community levels and the difference between community levels and community transmission before we move on?
There are a few. Eric asked, do you have a plain language video that talks about community level versus community transmission too? I don't believe we have that right now, but we do have a plain language tool that covers these same ideas and the differences between community level versus community transmission. April also said, absolutely, wow, that's so deceiving. Some really sick people are stubborn in my community and won't go to the hospital even when they're deathly ill. Absolutely, and that's why changing the way we talk about it not only doesn't change how dangerous it is, but it also confuses a lot of people in really bad ways. The question is, question I'm pulling, why does it matter if we use community levels rather than community transmission?
That's a good question. I would say it matters because community levels and community transmission measure different things. So people might think that because the community level in their county is low, that their risk of getting COVID-19 is low. But the community level doesn't really measure that. What's more accurate to measure your risk of getting COVID-19 is community transmission. And if community transmission is high, that means your risk of getting COVID-19 in your area is higher.
Absolutely. And a question from you too. Why did they change the verbiage from community transmission using community levels?
That's a really great question. And I think it was because they were tired of always saying that community transmission is high. It's basically been high in most areas throughout the pandemic. And maybe they felt like they wanted to give people good news, or they wanted to have a measurement that was able to show green sometimes. So they switched to community levels, which is more about whether hospitals are crowded. Hospitals aren't always crowded, so sometimes that shows low. But I think wanting to make the map look green isn't necessarily a good enough reason to switch how we're measuring the risk of getting COVID-19.
Absolutely.
If you have no more questions, I'm going to move us on to the next slide.
So the big question in all of this is if your county's community level is low or medium, are you safe from COVID-19? Unfortunately, the answer is not necessarily. Your county's COVID-19 community level doesn't tell you much about your risk of catching COVID-19. Like we said, even in places where the community level is low, people are still getting sick with COVID-19 and they can still get very sick, go to the hospital, even die. You can still catch COVID-19 even if your county's community level is low or medium. Remember, high and low mean very different things when we're talking about your risk of getting COVID versus the community levels in your county.
Any questions before we move on?
I don't think so. Your county's community, yes, okay. We're good. How do we check on our community transmission and levels? So for your community levels, the CDC has the tool up so you can look up your county on the CDC's website. As far as community transmission, Zoe?
Community transmission, you can check on the CDC's website as well. It's just not as easy to find on their website anymore. But if you Google CDC community transmission, it can take you to the page where it measures it. And on the page, it'll say, like, this is only for doctors. This isn't for the general public, which I think is interesting that they've put that now. But they are still tracking community transmission. You can still see that map on the CDC website.
I think we're good to move on to the next slide. So we talked about DC before as an example of a place where community level can be low, even though we know that the community transmission is high. So a place can have a low COVID-19 community level and still be high risk for you to actually catch COVID. For another example, Normaltown has a lot of hospital beds. Many people in Normaltown have COVID-19. 1 out of every 1,000 people in Normaltown has COVID-19. So if you're in Normaltown, your risk of getting COVID-19 is very high. However, because Normaltown's hospitals are not crowded, Normaltown's community level is low, but we know that there's still a lot of people with COVID-19 and the risk of getting it is very, very high. Any questions about that before we move on? I have one I can pull. Why is it important to know how high the community transmission level is in your area?
I would say it's important when you're making decisions about, for example, what kind of risks you want to take. Maybe whether you want to go to something that's indoors with masks off, maybe whether you wear a mask when you go into stores. If community transmission is high in your area, then that means if you go into a store with your mask off or other people have their masks off, your risk of getting exposed to COVID-19 is higher. If community transmission is low in your area, then maybe your risk is not as high. But when I make those decisions, am I going to wear a mask when I go to the grocery store? Am I going to go to this event where people are indoors with masks off? I'm looking at the community levels. I'm looking at the community transmission and not the community levels, because I find the community transmission is more accurate when we're talking about how many people in my area have COVID-19, and community levels are more about the hospitals, which doesn't tell me as much, right? Because once the hospitals are filled up, it's kind of too late for us to be taking our precautions against COVID-19. It means that we should have been taking those precautions already. So waiting until the hospitals have filled up to start taking precautions, I think is not as good as taking precautions when you know that COVID transmission is high in your area.
Absolutely. And then I think related to that, how can we stop hospitals from becoming full? And I think that, we're going to talk about some of the safety measures, but the big thing is knowing what your community transmission level is and taking precautions like wearing masks, especially when you have to be inside places like grocery stores.
Yeah, the fewer people in your area are getting COVID-19, the less chance there is that the hospitals will fill up. So by avoiding getting COVID-19, you're doing all you can to prevent hospitals from filling up. All right, I'm going to move us on to the next slide. All right, so now we're going to watch a video that ASN has put together about the different types of masks and how to make sure that you have the type of mask that is going to work best. So
I don't think the volume is on. So.
I'm going to have to start and stop my screen share again if the volume isn't working. Just bear with us for 1 second while we do this.
What
I'm going to try that again.
you need to know about COVID-19 and wearing a mask. Why should I wear a mask? It is important that we all keep wearing masks. Masks protect us from COVID-19. COVID-19 spreads through the air. It spreads through tiny germs in the air. Masks filter the air you breathe. Masks can filter out the tiny COVID-19 germs. Masks keep you from breathing in COVID-19 germs. If you have COVID-19, masks can keep you from giving COVID-19 to other people. What are the different types of masks? There are different types of masks. Some masks are made of cloth. Some masks are made of plastic. The plastic feels very soft, like cloth or paper. There are 4 main types of masks. Each type of mask protects you differently. We will list the types of masks from the ones that protect you the best to the ones that protects you the least. Remember, any mask is better than no mask. The types of masks are N95 masks, KN95 and KF94 masks, surgical masks, cloth masks. Some masks have an exhale valve on them. Exhale valves are pieces of hard plastic on the outside of the masks. Don't wear masks with exhale valves on them. Exhale valves can make it easier for COVID-19 germs to get in or out of the mask. Exhale valves make the mask not work well against COVID-19. What are N95 masks? The best masks are called N95 masks. N95 masks are made of soft plastic. They feel like they are made of paper or cloth. N95 masks cover all around your nose and mouth. N95 masks fit closely to your face. N95 masks are shaped to fit over your nose and mouth. You should wear an N95 mask if you can. N95 masks are sometimes called respirators. Respirator is another word for mask. What are KN95 and KF94 masks? The next best type of masks are called KN95 or KF94 masks. KN95 and KF94 masks are also made of soft plastic. They feel like they are made of paper or cloth. KN95 and KF94 masks also cover all around your nose and mouth. KN95 and KF94 masks fit almost as closely as N95 masks. KN95 and KF94 masks also are shaped to fit over your nose and mouth. KN95 and KF94 masks are almost as good as N95 masks. If you can't wear an N95 mask, try wearing a KN95 or KF94 mask. KN95 or KF94 masks are sometimes called respirators. Respirator is another word for mask. What are surgical masks? The third best type of masks are surgical masks. Surgical masks are also made of soft plastic. They feel like they are made of paper or cloth. Surgical masks also cover all around your nose and mouth. But surgical masks are much looser than N95 masks. They don't fit closely to your face. Surgical masks leave little gaps where some COVID-19 germs can get in or out. Surgical masks are not as good as N95 masks, KN95 masks, or KF94 masks. But any mask is better than no mask. What about cloth masks? The last type of masks are cloth masks. Cloth masks are made of fabric. Cloth masks also cover all around your nose and mouth. Cloth masks can fit differently. Some fit very closely to your face, like an N95 mask. Some fit much looser, like a surgical mask. Because cloth masks are made of fabric, they have tiny holes in them. Some COVID-19 germs can get in and out through those holes. Cloth masks are not as good as N95 masks, KN95 masks, KF94 masks, or surgical masks. But any mask is better than no mask. Can I wear my mask more than one time? Yes. You can wear your mask multiple times before it needs to be washed or thrown out. Cloth masks can be washed. Try to wash your cloth masks at least once a week. If your cloth mask is dirty, wash it as soon as possible. If your cloth mask is damaged or has holes in it, get a new one. Throw the old mask out. Surgical masks, KF94s, KN95s, and N95 masks cannot be washed. When they get dirty, they need to be thrown out. Try to wear a new surgical mask every day. But you can wear a KF94, KN95, or N95 mask more than one time. You can wear a KF94, KN95, or N95 mask for up to a week. Once the week is up, throw the mask out. Throw your KF94, KN95, or N95 mask out as soon as possible if It is dirty on the inside or outside. Part of it, like the ear or head straps, are falling off. It is bent or creased, or you have a harder time than usual breathing in it. I can't wear an N95, KN95, or KF94 mask. How can I make my masks safer? You can wear a close-fitting cloth mask over a surgical mask. This makes it harder for COVID-19 germs to get in or out. Wearing a cloth mask over a surgical mask means COVID-19 germs have to go through more layers to get in or out. That makes it less likely COVID-19 germs will get in or out. Look for masks with a nose wire. A nose wire is a piece of wire or metal inside the mask. The nose wire bends to fit the mask better around your nose. This means there are less gaps for COVID-19 germs to get in or out. You can also wear a mask brace. Mask braces are also called mask fitters. A mask brace is a piece of plastic that goes over your mask. It helps fit the mask to your face better. That way, there are less gaps for COVID-19 germs to get in or out. You can buy a mask brace online and at many stores. There are different types of N95, KN95, and KF94 masks. The different types are shaped different ways. If you can, try out a few different types of masks. You might find one that fits your face better. You might find one that is easier to wear. What if I can't wear a mask at all? Some people with disabilities can't wear masks at all. That's okay. It doesn't make you a bad person. If you can wear a mask a little bit of the time, try to wear a mask when you can. If you can wear certain types of masks, wear the masks that you can. If you can't wear a mask, you can try wearing a face shield. A face shield is a piece of plastic that goes in front of your face. It does not protect you as well as a mask does, but a face shield can protect you a little bit. If you can wear a mask, you should wear one. Not everyone can wear a mask. People who can't wear a mask are counting on the rest of us to wear our masks. They are counting on us to help protect them. When you wear a mask, you protect other people who can't wear masks from COVID-19.
All right, do we have any questions that came up during that video before we move on?
April asked, with the community level calculation, are they only counting hospitals getting full because of COVID cases, or are all patients regardless of why they were admitted?
The community level calculation is specifically about how many cases in the hospital have COVID.
Cases that do have COVID. Then what about cloth masks that fit well and have a filter pocket?
I would say that's about the same as wearing a cloth mask over a surgical mask. So better than just a cloth mask by itself, but not as good as a KN94, KF94, or KN95.
And question I'm pulling, why do we need to wear masks if the community level is low in our area? I think we talked a bit about that, about your risk being very different than what the community level is. But Zoe, do you have to add?
Yeah, I think if your community level is low, community transmission could still be high. So that's what I would check to make the decision about whether to wear masks in my area. And even if there isn't a lot of COVID in your area, we all know that the risk isn't zero, and you're going to be like on a bus for a long time. You want to be protecting yourself still, and you want to be protecting the people around you. So I would still encourage wearing a mask when you can.
Absolutely. And Toddle said there are cloth masks that are pandemic standard that were developed last year. Is the clear plastic masks used so people who are deaf can read our lips made of the same plastic that's mentioned in the video? So the cloth masks that have the clear plastic in the middle. I believe those are the same, basically the same protection as a standard cloth mask.
Yeah, I think those are more comparable to a cloth mask than a N95 mask.
Where is the mask info coming from? I read last year that you can reuse KN95, but leave it in a bag for a week and reuse it, or in some cases, out if it looks dirty or other things like that. So where is the mask info coming from?
It's a good question, and it's not one I have an answer for you right now because I wasn't the author of this particular resource, but I can look that up.
And from YouTube, do you have any tips for wearing masks and glasses at the same time? I'm struggling.
The only tip I have is the nose wire. That's something that can help block the gaps between your nose and the mask, and the gaps between your nose and the mask are where the air comes out and gets between your glasses and fogs your glasses up. But if you're still struggling with a nose wire, I think there's some sort of glasses defogging solution that you can buy to put on your glasses. I don't wear glasses though. Dean, am I missing any tips here?
You're totally right. There is sprays and wipes with the same solution to make your glasses anti-fog. I also use my glasses as kind of a litmus test to make sure that my mask is like nice and snug, because I'll put my glasses on top of the nose wire. And if they get foggy, it's not a super good seal. And I don't think I'm seeing any more questions for this slide.
Great. For the person who asked where is the info from on this slide, I have pinged one of our staff members. I'm waiting for an answer on that. So if we get that during the webinar, I will follow back up.
What you need to know about all keep wearing masks.
Let's go to the next slide.
What you need to know about COVID-19 and wearing a mask.
Okay, here we go. So let's talk about what to do to stay safe. There are some things that we know keep us safe from COVID-19, like wearing masks when we're indoors with people we don't live with, for example, on a bus or in a store, and getting all our vaccines and boosters. If you haven't had your booster dose yet, talk to your doctor about where you can get one, or look on vaccines.gov to find out where you can get one. Staying home when we can, if we're able to work from home, for example, or go to school from home, that lowers our risk of getting COVID-19. And if you want to socialize, hang out with other people, go to events, it's a good deal to remember that COVID-19, the risk of catching it is lower outside than inside. So if you're able to hang out with people in a park, for example, or go to an event that's outdoors, your risk of getting COVID there is lower than if you were inside. I did want to make sure to talk about antiviral medication. There are medications now that were specifically developed to fight COVID-19. So if you get COVID-19, you should talk to your doctor about getting antiviral medications. People with developmental disabilities are part of a high-risk group. That means it's been found that when people with developmental disabilities get COVID, we might have worse outcomes. But being part of a high-risk group means that we're eligible to get the antiviral medicine. So definitely, if you get sick with COVID-19, ask your doctor about that.
And you may need to close and reopen the presentation to show the most recent graphs.
Yeah, I know we wanted to show some graphs to you. Let me. All right. So here we go. Just to show people what the differences between community levels and community transmission. This is the current CDC community levels map. And then this is the map of community transmission. So you can see there's a lot of places where transmission is high, but the community level is marked low. I'm just going to go between them again to show you the difference. So look at the area of the map where you're from, community transmission map that we have here, and now see what your community level is. So this is why I think the COVID-19 community levels can be a little bit misleading, because even when transmission is very high, the community level can be quite low. All right, I know we've had some discussion in the chat. Do we have any questions we should circle back to?
There's a question. I have an autism diagnosis and got my last booster in November, and am I eligible for another booster?
I believe if you are over 50, you're eligible for another booster, but otherwise, not yet, I don't think.
Would you recommend getting a second booster shot if you're under 50?
So if your doctor thinks that you should get a second booster shot, for example, if you're immunocompromised, then that's definitely something that I would do. I don't think second booster shots are available generally to people under 50 at this time. But if your doctor says that you should and you have like a special circumstance that means it's available for you, then definitely go for it.
And then some questions I'm going to pull. How can we keep kids who can't be vaccinated yet safe?
So yeah, kids under 5 can't be vaccinated at all right now. And the way to keep them safe is to keep COVID-19 transmission levels as low as possible in our communities. So that means when you look at that map that was all red when we just saw it, we should be trying to get that out of the red into lower levels. So the way we can do that is by being careful about our own risk of getting COVID-19, wearing masks, staying inside when we can, going to events outdoors rather than indoors, all those things we just talked about. And then if you have kids in your household or you're going to see kids, being very careful, maybe testing before you see them. Everyone can get rapid tests for free from the government right now. So that's something else that we should be looking into. Being careful with our own risk of getting COVID-19 is a way to keep those around us who can't get vaccinated.
Absolutely. And just some clarification, right now you are eligible for a second COVID-19 booster if you're over 50 and got your first booster at least 4 months ago. If you're 12 years older and you're moderately or severely immunocompromised and got your first booster, again, at least 4 months ago. Or if you're 18 or older and got 2 doses of Johnson & Johnson vaccine at least 4 months ago.
Thank you so much.
Absolutely. And then are K95 masks expensive or hard to find?
So what I would use is there's something online called Project KN95, which, pardon me, Project N95 is a website that can show you where to get genuine ones because there are some fake ones out there. But that's a website that I would use to shop for COVID-19 safe masks.
And then from YouTube, I thought everyone who got COVID could get Paxlovid from the recent White House push to get it out there. So that's a question about everyone being eligible to get that antiviral.
Because I had said if you're in high risk groups, you're eligible. That's interesting. I'm going to look that up. Thank you.
And then a question I'm going to pull. How can we get accurate information about COVID-19 numbers in our areas? We talked about this a bit earlier, but I think it's good to reiterate that you can find both community transmission and your county's community levels on the CDC's website. Community transmission, like Zoe said, is a little harder to find, but it is still there. Or yes, community transmission. And then another one I'm pulling. What changes do we, community-wide, statewide, nationwide, need to make to keep each other safe?
I think community-wide, there would be a lot of changes that we would need to make to keep each other safe. Ideally, we would want to see much more investment in COVID-safe infrastructure, so things like indoor filtration in buildings. and things like that. And we would want to see much better policy to take care of people who get COVID-19. So making sure that people who don't have insurance can still get tests and can still get medicine. Making sure that there's good paid leave policies so that people don't have to go into their jobs when they're sick with COVID or aren't incentivized to do that. All of those kind of larger policy changes, I think, would be the next step in really taking care of our population as far as COVID-19 is concerned. So looking up who's eligible to get Paxlovid, I'm looking at a fact sheet that was published in April. And it says that it's people who are high risk at COVID who are more likely to be prescribed it right now. I also have information following up on the question earlier about where the information about masks was from. A lot of it is from Public Health Collaborative, which is at publichealthcollaborative.org. They have information about masks that's available on their website, and we sourced a lot of our information from them.
So then just another one that I'm putting. Thank you, Zoe, for putting that in chat. If a low community level doesn't mean that I'm safe from COVID-19, what's the point of using community levels? And you touched on this a bit earlier, but.
Yeah, no, that's a really good question. And I think the point of community levels is that the CDC was tired of having the map be all red and they wanted something different. Not to sound cynical, but I think the community level, it doesn't measure whether you're safe from 19, it measures something else. It mostly measures whether the hospitals in your area are overwhelmed with COVID-19 patients or not. So it's all about what you're using it for. If you want a measure of the capacity of the hospitals in your area, I think the community levels aren't bad. But if you want a measure of your personal risk of getting COVID-19 when you're out and about, it's the community transmission map that you need to take a look at.
Absolutely. It's good information to have, but it should not be a replacement for knowing what your actual risk of getting COVID is, especially if that's how you're deciding, what safety measures to use and when and how. Then another question that I'm pulling, what happens to disabled people who need to go to the hospital if the hospitals are all full?
That's a good question. And a lot of people have been having problems when hospitals in the area are overwhelmed with getting treatment that they need. Whether that's, for example, someone who's had an allergic reaction and needs to go to the ER, or even someone who's had a scheduled surgery or something like that. When hospitals are very full, they can do something called postponing elective procedures. And elective doesn't mean like you're just having it for fun. It basically means any medical procedure that's scheduled ahead of time. So if you have something that you need, whether that's a surgery for cancer or some other kind of medical procedure that's done in a hospital, a test, or infusions or anything like that, people have had problems with those being canceled when hospitals in the area are
So, are there any more questions about anything that we talked about?
All right, thank you all so much for coming and for your great questions. We're excited to be able to talk with you today about the community levels tool, what it means, what it doesn't mean, and how we can all stay safe as the pandemic continues. This will be available on our YouTube after we finish streaming. The recording will still be up there. You can also find all the information we covered in our resource on COVID-19 community levels, which is on our website. If you look under plain language COVID-19 resources, all of our resources are there. We have resources on many other topics, like we have resources on booster shots, we have resources on the vaccine. We have videos explaining what COVID-19 is in general. So all of that is available on our website. Something else that I was going to say. I don't remember what it is now. I'm seeing in the chat someone asked, am I allowed to share this information in video recording? Yes, definitely. Please go ahead and share this information. We want to make sure that as many people as possible have accurate information about COVID and about the community levels tool, which can be difficult to understand, both the tool and sort of the what happened when it got switched over. So I hope that this has cleared up a little bit what goes into making the decision about community levels and the difference between community levels and community transmission. Thank you all again for joining us, and we'll see you around.
Thanks.